Hi everyone, I'm Emily. This is going to be a presentation on Alzheimer's disease and an exercise prescription for people or a person with Alzheimer's disease. First of all, we're going to talk about what is Alzheimer's. It is a progressive disease that aids in the rapid decline of a person's cognitive functions. The disease disrupts the neurotransmitters that are located in the brain. This contributes to a person's cognitive decline, behavioral issues, psychological problems in one's body. This basically means that Alzheimer's will take over the brain, and with the result of cell death, there will be a lot of issues that incur for the person. They will eventually lose their complete memory and not be able to swallow and not be able to use their bladder. They become more like a child again. They don't have that independence anymore. And there are multiple stages of this disease, but we'll go on to that later. This disease is characterized by pathological markers in the brain, which are high numbers of amyloid plaques and tangles, which can cause vascular damage in the brain, which will result in the cell death and the eventual shrinkage of the brain. For the causes and risk factors, there aren't as many causes as there are risk factors because it's still being researched, but it's believed that amyloid proteins and tangles cause cell death, vascular damage, and eventual brain shrinking, which results in all of the damage with the brain and memory and functions of the body. You can see in the picture that there's a normal brain section as well as one with the Alzheimer's brain section, and they have the tangles in there which are affected. Age is a large risk factor for this. Alzheimer's is typically found in people over the age of 65. And they're more at risk, but it is not a normal part of aging. Sure, your memory does go as you age, but this is more progressive and severe. It is said 1 in 9 people over 65 have Alzheimer's. And there's also a fact that 1 in 3 people over the age of 85 have this disease. Family history is also a risk factor for this. It's said that those with a parent or sibling, so a first-degree relative, that has AD are more likely to develop the disease rather than those who don't have any family members with it. And people that have 2 family members at the first degree with this disease are even higher risk. There's also a gene for this disease that is thought to aid into it. It's called the APOE4 gene. There are multiple different forms of this, but this one seems to be the most severe to put people at risk. This gene actually helps certain proteins transport cholesterol into the bloodstream, which will create a plaque buildup and increases your risk of Alzheimer's. People can actually be tested for this, and some people are, but there's not many ways to prevent it. But we'll discuss that in a study later. For the diagnosis of this disease, it's not super complicated, but they'll start off with reviewing medical history and family history. So medical history, they'll see if you have any previous brain damage or brain injury in the past. And family history, they'll see if anyone has this disease or experienced it or anyone died from it. They will also evaluate mental status and mood to see if there has been any progression, because in later stages, the mood of a person will decline significantly because their quality of life is going. They're also doing a memory evaluation. They'll show patients a series of words and pictures and see if they can memorize them. This could be a couple weeks later, a couple days. And with the results, they'll be able to see how bad their memory has declined. There's also a neurological exam that is included in the diagnosis. Like I said earlier, there are stages of this disease. The first stage is the early stage. This is the least severe. This person will still be able to be independent. Like they can still drive and go to work and socialize normally, but they will have trouble coming up with the right words and remembering names of the people and planning things. They won't be able to plan events as much or remember or organize themselves, which can definitely be frustrating. This isn't affecting their quality of life as much because they can function as a normal human being. But then as it progresses to the middle stage, This is typically the longest stage, and you can progress at different levels. It can be for years, and it can be months. It really depends on the severity. Eventually, the person will need more care. In this stage, the person may become upset and angry at random, forget their own past, have confusion on the day of the season, like they will wake up in the morning and not know what season it is. They have to be reminded by a caretaker or someone in their family. There's also a big case of wandering. This is when a person with Alzheimer's will go out for a walk, and they will be going around thinking they're in the right spot, and then eventually they'll realize, where am I? And this happens often, and they'll be lost, and people have to go find them. Also in this stage, it's said that eventually the person will have trouble controlling his or her bladder, which will take down their quality of life because they have to depend on other people, which will cause a lot of frustration for some, and which causes a lot of people to go into more proper caretaking with someone outside of a family member, like a home care person. And late stage, which is the final stage, which is the most sad, this is when a lot of the people have the severe personality changes. They won't really be able to communicate, and they require around-the-clock care, and they have a lot of changes in their physical capabilities. They won't be able to walk as well, or even walk at all, or stand, and swallowing becomes an issue. When swallowing becomes an issue, that's when the person does become a lot closer to death, because it's hard for them to get the nutrients that they need, and that tends to be the cause of death, is when they get their lack of nutrients and they eventually forget to breathe. You can see in the picture as well the difference between a normal brain and a brain with Alzheimer's disease. You can see how it slowly dies and eats away at the cells, and it's very depressing. There is possible prevention for this. People try to work their brains as much as possible to prevent getting Alzheimer's, but sometimes it's inevitable with family history. Healthy lifestyle, so eating healthy with no smokings, having social activities, being at appropriate weight, and lack of head injury, that can help with preventing this disease. Also being physically active, just keeping your body in shape, keeping your heart in shape as well. Brain exercises are also encouraged with puzzles, math games, and memorization games. For exercise in Alzheimer's disease, there was a study performed. They took 69 cognitively normal adults, and they all had different physical exercise levels, so that they were either not very physically active, relatively sedentary, or they were very active. And they took cerebral spinal fluid from them and tested to see their levels of biomarkers in that fluid, to see how at high risk they were for Alzheimer's disease. And with the results, they were not super significant, but there were some that showed that individuals with higher levels of physical activity, they had lower amounts of amyloid beta and other biomarkers in their cerebral fluid, whereas the people with lower physical activity levels had higher at-risk levels for biomarkers. So they weren't significantly higher than the people that were physically active, but they were at the level of being at risk. For my case study, I created a woman named Gertrude. She's a 72-year-old female in the early stages of Alzheimer's disease. She weighs 130 pounds and is 5'4". Her father had a heart attack at 48 years old, but had no other history of heart disease in the family. Her blood pressure was 120/78, but that is because she's on beta blockers, which control her hypertension. She's relatively active, but not on a super efficient level. She walks 4 to 6 days a week for 10 minutes with her spouse, and her LDLs are 130, HDL is 45, and her fasting blood glucose is 80 milligrams over deciliters. So with those risk factors, she is put into the moderate risk group, which only requires a medical exam before performing vigorous exercise. So this won't put her at much of a risk of not being able to do her exercise. The goals that she would like to become more confident with her balance, as well as picking up her speed and distance with walking. Since she is in the early stages of Alzheimer's, she is still physically capable of doing these activities. And she hopes to improve her quality of life and maybe slow down the progression of her disease. Special considerations are that she is older with memory issues and is on beta blockers that help with hypertension but also bring down her heart rate. So she will not be able to reach her targeted heart rate, but she will still be able to exercise and will be at a lower intensity because of her age. For exercise testing, for her, we would do a 30-second stand test, which is when they will get the person to sit in a chair, typically one that has rubber stoppers on the bottom so they don't slip, and they'll time them for 30 seconds to see how many times they can get out of that chair and stand up in 30 seconds without using their hands or their arms. The higher number, obviously, the more efficient and physically capable the person is. Also, there's a 6-minute walk test. This is to record the distance covered after 6 minutes. This will also show their cardiovascular health as well as just their muscular health as well. The exercise prescription that I wrote for this client is for her aerobic exercise. She would do 5 to 6 days per week at 30 minutes at a moderate intensity. Since we weren't doing testing on 1 rep max or anything like that, we were doing on a scale of 1 to 10, so this would be at about a 5 or 6. The 30 minutes can be broken down into 10-minute increments a day, so she'd go on walks with her spouse or go on a stationary bike in her house, and it could be 10 minutes at a time. It's as long as it adds up to 30 minutes a day, so it's completely okay. For her strength portion, not incredibly necessary for someone at this age, but just to have some improvement in muscle strength. So about 2 days a week at a light intensity. This should be done in about 10 to 12 repetitions. So this could be stair climbing, going up and down the stairs about 10 times, light arm curls with like a 2-pound weight, and stand from a chair, which is like the testing, but she could eventually add weight by holding on to like a dumbbell or like a heavy book. This can help her hip extension, hip flexion, so she'll be able to get up and move around as wanted. Flexibility, we're say 2 days a week. This should be an intensity where you're just enough to feel a slight pull, nothing too painful, hold movements for about 30 to 60 seconds. This could be with toe touches, arch or stretch, with a towel if you can't reach your hands, all the way to touch each other, and neck flexion stretch. Balance is very important for someone at this age. So this would be 2 to 3 days a week for about 10 minutes a day. The intensity could be light with some progression, but with guidance. So like a 2-legged leg stand, tandem walk, or one-legged stand to see how long she can hold these, or shut her eyes at points as well to progress it. And all this should be done with supervision so she does not fall. And in conclusion, Alzheimer's disease will not impact physical capabilities of most victims until further stages, so they are still able to exercise their brains, exercise their bodies, and hopefully improve their quality of life while it's still possible, and maybe slow down some of that cognitive progression. And the exercise for both the body and the mind can hopefully lower the risk of getting Alzheimer's disease when you're young and improve cognitive function for a longer amount of time in older adults. Thank you.